Hello, future surgical maestros. Welcome to a pivotal chapter in our journey through the realm of suturing techniques. How to flawlessly engage the needle in the needle holder. Along with this, we will also showcase how much suture length is required during intracorporeal suturing and how to engage the needle, and of course how to pass the needle across the ports. So let's not waste any time and start with the first part of this video, that is how to measure the length in lap surgery. So roughly in lap surgery the suture length we keep is around 20 to 24 centimeter. So to measure it we hold the needle with the help of index and thumb finger. So the span of my hand's finger is around 8 to 8.5 centimeter. So roughly it will be similar in average size male. So otherwise you have to know the distance between the this span. So if I take one full bind, then the length of suture will be around 16-17 centimeter. Even take another, so the now the suture length will be around 24 centimeter. So then you have to remember that this is the ideal length. Keep it around 20-24 centimeter, because if we take too much suture inside, especially in the teething stage of your lap surgery, beginning, so then it will becomes difficult. So take one full bind, one half bind around your hand, and that will give you roughly around 24 centimeter length of the suture. So now let's start with our second part of this video, that is how to pass the needle across the port. So first we will demonstrate how to pass a 31 needle. So this is 30 basically PDS suture. The needle length is 31 and if you remember our talk on the surgical needles, so it is the cord length that matters. So we hold the needle approximately 2-3 centimeter from the swage end, that is the thread by the thread joint, and with the help of this jerky movement support this port and pass the needle across. So it will easily pass across, and again you have to support the port. So in the second part of this needle passing, we will try with 40 number 1 bicycle needle. So this is number 1 bicycle needle. Again the needle length is 40 quite thick needle, and then again the technique will be same, that you hold the thread approximately 3 centimeter from the swage end, and then while supporting the port with the jerky movement you pass it across. So basically it will coil and will easily. Similarly you can pull out the needle with the same maneuver. Let's try a 45 needle. Can we pass it across 10 port? This is a number 1 nylon, and the needle length is 45 as you can notice. So again this is quite a thicker needle, and this will be a needle which we will demonstrate during the live surgery of cruroplasty of intracorporeal suturing. So this is one of the common needle we use, and so again as I said, 12 port would have been ideal, but if not we can pass it across 10 Again technique is same, hold the thread approximately 3 centimeter and support the port, and then with the help of this clean single jerk you can pass. The needle coils, and simply you can introduce or take out the needle. The technique will be same. Sometimes it may damage the diaphragm of the port, but that you have to accept as a collateral damage and change the port. And so you can notice that 45 needle has easily passed through the 10 port. So we will demonstrate again the live intracorporeal suturing, so stay tuned. So when friends you don't have a if you are using a 5 port here, then the technique will be you introduce the needle holder, take out the port, and then with the help of a needle holder you can simply push it across the incision, or with the help of hands you can guide the this needle across the skin incision, and then with the help of needle you can push, then introduce the port over the needle holder. Third part, this will be how to engage the needle in the intracorporeal suturing. So friends, there will be many technique, and as I said multiple times before also, you have to know one, practice one, and master one. So the simple technique I am showcasing here is that you just drop the needle on the viscera, I mean, and then you approach the needle approximately at the 90 degree at the 50% of circumference. So half the length is ahead, half the length is uh, back side toward the swage end and the tip point. So this is one half we follow in open surgery. We follow 2/3, 1/3. So then you approach the static limb of the needle hole is pressing the viscera, and the active limb that is opening is above. So as you approach and press, you gradually start uh, holding the needle. Hold the needle as close to the tip as possible. See again, you approach at 90 degree, and it will automatically, like autocorrect, it will get into 90 degree. So this is very good technique you have to master, and to have in your armamentarium. See again in a close-up view. So as you press, it will automatically get at right angle. And so if that, so, I mean, the needle is not at a correct angle to you, so then you can hold the swage end of the needle, that is thread end, and then again you approach the mid length of the needle, and you start holding. Don't lock the needle holder. As you will start holding and I mean grasping the needle, you can manipulate the needle with the help of this thread. So these two techniques you should be, I mean, knowing. And further we will also showcase other tips and tricks during the live surgery also, in which we do the niche fund application during chloroplasty. So this is the way you can manipulate. So friends, now we have reached the end of this video. I hope we were able to make some I mean new addition to your knowledge, add a few new insight to your knowledge. So do practice. Practice is the key, friends. So next video in this series will be live. In this series will be live demonstration of intracorporeal suturing while doing basically this hydroplasty, I mean chloroplasty during nascent fund application for reflux disease.